Welcome back to my channel. Learn with Professor Janula. If you're new here, don't forget to subscribe and hit the bell icon for notifications. In today's video, we're going to learn about Rh-negative mother and prophylactic anti-D. Let's get started. First, let us see what is Rh factor. The Rh factor is a protein found on red blood cells. If a person has this protein, they are called Rh positive. If they don't have it, they are Rh negative. Now here's the problem. When an Rh negative mother is pregnant with an Rh positive baby, a small amount of the baby's blood can sometimes mix with the mother's blood. The mother's body then sees the baby's Rh positive cells as foreign and starts making anti-Rh antibodies. These antibodies don't usually harm the first baby. But in future pregnancies, if the next baby is also Rh positive, the mother's antibodies can cross the placenta and attack the baby's red blood cells. This can cause a serious condition called hemolytic disease of the newborn, also known as erythroblastosis fetalis. To prevent this, doctors give an injection called anti-D immunoglobulin to Rh-negative mothers. It helps stop the formation of these harmful antibodies and protects future babies. Rh incompatibility happens when the mother is Rh negative and the father is Rh positive, so the baby becomes Rh positive. If a small amount of the baby's blood mixes with the mother's blood, her body may see the baby's red cells as foreign and make anti-D antibodies. These antibodies can cause problems in future pregnancies by attacking the baby's red blood cells, leading to hemolytic disease of the fetus and newborn. Now let us see about the role of anti-D Rh immunoglobulin. Anti-D is a special injection given to Rh-negative mothers. It helps prevent the mother's immune system from making antibodies against Rh-positive blood cells. It works by destroying any fetal Rh-positive cells that may have entered the mother's bloodstream before her immune system can react. This way, the mother does not become sensitized, and it protects future pregnancies from complications like hemolytic disease of the newborn. Now let us see about the important investigations. The first one is maternal indirect Coombs test, ICT. This test checks the mother's blood to detect anti-D antibodies. It tells us if the mother has already started forming antibodies against Rh-positive blood. Another investigation, cord blood typing. After delivery, the baby's cord blood is tested to find out the baby's Rh status, whether the baby is Rh positive or Rh negative. The next investigation is Kleihauer-Betke test. This test helps to measure how much fetal blood has mixed into the mother's circulation. It is used to decide if the mother needs an extra dose of anti-D. Now let us see the indications for giving anti-D prophylaxis. The first indication is routine antenatal prophylaxis. Anti-D is given to all Rh-negative mothers who do not have antibodies. It is usually given at 28 weeks and 34 weeks of pregnancy. In some hospitals, a single dose at 28 weeks is also followed. The next indication is postnatal prophylaxis. After delivery, if the baby is Rh positive, the mother should receive anti-D within 72 hours. This helps prevent antibody formation for future pregnancies. Other indications are sensitizing events. Anti-D should also be given after any situation where the baby's blood might mix with the mother's blood. This can happen in conditions like abortion or miscarriage, where some fetal blood may enter the mother's circulation. It is also needed after an ectopic pregnancy, when the pregnancy develops outside the uterus, or in a molar pregnancy, where there is an abnormal growth of placental tissue. Anti-D is also required after invasive procedures such as amniocentesis or chorionic villus sampling, because these tests can cause tiny amounts of fetal blood to enter the mother's bloodstream. Finally, if there is antepartum hemorrhage, bleeding during pregnancy, or abdominal trauma, anti-D should be given to prevent the mother's immune system from forming harmful antibodies. The usual dose of anti-D is 300 micrograms, also known as 1500 IU, given as an intramuscular injection. This dose is enough to protect the mother if she has been exposed to up to 30 milliliters of fetal whole blood. In early pregnancy, that is, before 12 weeks, a smaller dose of 50 micrograms may be given after events like miscarriage or other sensitizing situations. Now we will discuss the nursing responsibilities related to anti-D administration. During the assessment, the nurse should first check the mother's blood group and Rh typing early in pregnancy to identify if she is Rh negative. It is also important to review the mother's obstetric history, looking for any previous abortions, blood transfusions, or Rh-incompatible pregnancies, as these may increase the risk of sensitization. The nurse should continuously monitor for any sensitizing events, such as vaginal bleeding, abdominal trauma, or invasive procedures, where fetal blood might mix with the mother's blood. During the intervention phase, the nurse should administer anti-D as per the obstetrician's order. Before giving the injection, it is important to confirm that the mother is Rh negative and that the baby is Rh positive, usually through a cord blood test. The nurse must also make sure that the mother has not already been sensitized, which is confirmed by a negative indirect Coombs test. Once these steps are verified, the anti-D injection should be given intramuscularly within 72 hours after delivery, or after any event where fetal blood may have entered the mother's circulation. After giving anti-D, the nurse should monitor the mother for any side effects. Some women may experience mild pain or soreness at the injection site, which is normal and temporary. In rare cases, there may be allergic reactions, so it is important to observe the mother for about 20 to 30 minutes after the injection for any signs of allergy. The nurse should also document all details carefully, including the date, dose, batch number, route, and site of the injection, as well as the Rh status of both the mother and baby. Any adverse reactions or unusual responses should be recorded and reported promptly. During health education, the nurse should explain to the mother the importance of anti-D in preventing complications in future pregnancies, such as hemolytic disease of the newborn. The mother should be reassured that anti-D is safe for both her and her baby. She must also be informed that anti-D needs to be given after every pregnancy if the baby is Rh positive, even after miscarriage or abortion. Additionally, the nurse should emphasize the need for regular antenatal checkups and blood tests to screen for the mother's blood group and antibodies, ensuring early detection and proper care. Rh-negative mothers are at risk of forming antibodies if carrying an Rh-positive fetus. Prophylactic anti-D immunoglobulin prevents sensitization, thereby protecting future pregnancies from hemolytic disease of the newborn. That brings us to the end of today's session on Rh-negative pregnancy. I hope you found this video informative and helpful. Thank you so much for watching, and don't forget to like, comment, share, and subscribe for more nursing and health-related content. See you in the next video.